Welcome to Healthy Living in Lowell, a production of the Lowell Health Department and its many community partners. This month, we're talking emergency preparedness in honor of Emergency Preparedness Month, which is the month of September, and I'm so excited to be joined by Chief Jeff Winward of the Lowell Fire Department. So, Chief, thank you for being on the show today.
Well, thank you for having me, Kate. It's great to be here.
Excellent. And can you tell me a little bit about your role? I understand you have two roles within the city of Lowell.
Yes, I'm the fire chief in the city of Lowell, in charge of the fire department, the 213 men and women that make up the Lowell Fire Department. But I'm also the emergency management director for the city. And each community in the Commonwealth has an emergency management director. And we have two deputy directors. And we plan and handle the large-scale emergencies in the city. And police, fire, and EMS handle more of the routine emergencies, the day-to-day type of emergencies.
Excellent. And so does the city of Lowell have an emergency plan? I imagine we do. What does that look like?
Yes, we have a comprehensive emergency management plan, and it's modeled after a template that our partners at the state level, the Massachusetts Emergency Management Agency, they put out this template, and each community in the Commonwealth develops a comprehensive emergency management plan. And there's a base part of the plan that talks about the city, the demographics, our critical infrastructure, our analysis of what we need to protect and how we're unique to some other communities. And then the second part of the plan has different sections for each department in the city. Emergency management is supervised by the fire department, but each department in the city, all the leaders in the different departments come together when there's a large-scale emergency in the city. And we all work together when we find that we can get a lot more done when every group in the city is represented. And we get together in our emergency operations center and we manage the emergency a lot more effectively when we have representation from all departments.
And what type of emergencies does that plan include, or what type of emergencies should residents be informed about?
Sure. Well, the fire department, police, and EMS agencies handle the routine day-to-day emergencies, medical emergencies, fires, car accidents, crime. But when there's a large-scale emergency, that's when the emergency management plans take effect. Things like flooding, blizzards, we've seen a few of those in the past here in the city of Lowell. But there are many other type of emergencies, from terrorism to earthquakes to hurricanes to massive fires. But if you have a plan, a comprehensive plan, you can adapt it to different types of emergencies. And when you prepare for one type of emergency, you can use that when any type of a large-scale emergency happens to you and your family.
Wow. And so how often is the plan being updated or looked at, or do you do tests of the plan? What does that look like?
Sure. The SEMP plan, the Comprehensive Emergency Management Plan, a new one is being developed now, and once we finish it, we'll update it once a year, and we'll have different large-scale exercises during the year with multi-agencies. We'll get together and we'll set up different scenarios, and we'll practice the plan. We'll get to know each other. We'll get to work with each other. We develop relationships, which comes in handy when you get to know people on a sunny day. It's a lot better than trying to get to know people when the real emergency happens. And then we have other plans for some of the large-scale events in the city, like the Folk Festival, the Winterfest, the Bay State Marathon, the Southeast Asian Water Festival. We put together a protective service plan with our federal, state, and local police, EMS, fire agencies. And we come up with a plan on how we're going to protect the citizens for unique events when there are a lot of people in a small place.
Wow, I didn't know that you guys did that. That's amazing. And are there specific residents that are more at risk during an emergency situation, less at risk? How does that look like?
Sure, the elderly, the young, and the handicapped are generally the most susceptible to emergencies. But we ask all people to have a plan, to practice that plan, and to be prepared for anything that might happen.
And so does our emergency plan in Lowell, does that take specific precautionary measures around those at-risk residents?
Sure. For example, when we have a big blizzard or a flood situation in the city, we'll open our EOC and we'll be in contact with the hospitals, with the nursing homes, with the university and the college to make sure that if they lose power, their generators are working, or if they have any big emergencies that they can't handle, we'll help them. We'll bring in the resources that are needed. And we can also go to the state, to the Massachusetts Emergency Management Agency. They're based down in Framingham, and they have a regional office in Tewksbury, and we work very closely with our partners at MEMA. And they can bring in resources to help out with any type of emergencies at some of the facilities like nursing homes, hospitals, and college dormitories.
Wow. And tell me again what the EOC is. This is not my forte, emergency preparedness.
Sure, we have an emergency operations center in the
Okay.
city, and when we have a large-scale disaster, we'll open our EOC, and we'll bring in department heads from key departments around the city, police, fire, city manager's office, EMS, DPW, health department, water, wastewater. If it's an emergency at a school, we'll bring in the school department, or if it's an emergency at the university, we'll bring in emergency management staff from UMass Lowell. And we get together in this one location, and we can support the incident command team that's out in the field at a command post, and we can bring in whatever resources they need to manage the incident.
Wow, a lot of work.
It is a lot of work, and we practice this plan when we have our festivals, and we get together with our partners, and it's great having that experience, so that when the real incident happens and you're under pressure, you have that training to fall back on.
Wow. So what should residents like myself, what are some of the most important things we should be prepared for, or that we need to know in the event of an emergency situation?
Sure, well, it all starts with having a plan, having working smoke detectors, carbon monoxide detectors in your house. It's good to have bottled water in your house in case there is a big emergency and you lose your water. It's good to have a gallon of water per person per day for maybe 3 or 4 days.
Wow.
It's good to have non-perishable foods available, like granola-type bars or dry cereals, in case you lose electricity for a long time. It's good to have an emergency generator and to know how to use it properly, and to keep it away from doors and windows and away from the house, and have it fueled up. It's always good when there's a storm coming, or you think there may be an emergency coming, to have all your batteries charged. Have flashlights available with charged batteries, cell phones charged up. And it's good to have an escape plan if you need to get out of your house in case of a fire or a gas emergency. It's good to know where your utility shutoffs are in your house, your gas, your electricity, water. It's good to have a meeting place, especially if you have children in the house, a place outside where everyone agrees to meet. And it's always important to get out of the house right away and call 911 as soon as it's feasible. And if you have a neighbor that you're friendly with, maybe have a meeting place at their place, and you can make the 911 call from there.
Now that's a lot of things you just mentioned.
Sure.
Is there anything that you have brought with you, perhaps, that kind of outlines those things that people should be prepared about?
I did. We have this Lowell Community Preparedness Guide, and it has tabs on it. And there's different sections on the guide about basic disaster supply kit, which I know you'll talk about a little bit later in the show, but about how to prepare for things like a blizzard, a bomb threat, a chemical spill, earthquake. We don't get a lot of earthquakes in this area of the country, but it's always a possibility. Evacuation, if there's a flood, what the evacuation procedure might be. Power failure, we've had some big power failures in the past with some of the windstorms. We always tell people stay away from down lines, whether it be a power line, a phone line, a cable TV line. We consider all down wires live. You never know if a cable line is going to be touching a power line down the street. So anytime you see a wire on the street, stay away from it and call 911. We have a section for flooding, for sheltering in place, for a terrorist threat, a tornado. We have a section on social media. One of the things we do is we like to notify the public about what they should be doing to prepare for an emergency. Right. And we use different methods. We use social media, Facebook, Twitter. We use the City of Lowell website. We use LTC, the local newspaper, the local radio station. We try to get the message out in many different ways, that people need to be prepared, and what procedures they need to do to keep their family safe.
And so that would be if you're asking the public to do, that would be, I imagine, in a bigger emergency where you're asking the public to go to a shelter or evacuate or stay at home. Is there different methods that you use? What would be?
Yeah, it depends on the situation. Usually we have incident commanders out in the field, and they determine, based on the emergency, should people shelter in place? Should they evacuate? Should they go to a shelter? For example, if there's a big fire and there's some hazardous smoke in the neighborhood, we may ask people to evacuate. But if we have a high rise and we have a fire on the first floor and there's people on the 8th floor, we may be able to shelter those people in place. Keep the windows closed, turn off the HVAC units, especially if people are handicapped. Sometimes, in nursing homes, we ask people to shelter in place. Depends on the situation. And our incident commanders make that determination, and we try to get the message out to the public in as many ways as possible.
Wow. So I know that there is a service that we have through the City of Lowell called Code Red. Can you talk a little bit about how that could help residents in an emergency situation?
Sure. Our emergency notification system is called Code Red, and people can sign up for it at home. They can go to the City of Lowell website, lowellma.gov, and click on the link for Code Red, and they can enter their personal information, and they can choose what types of emergencies they want to be notified about and what manner they want to be notified. You can be notified for one type of emergency via text, another one via a phone call on your landline, and maybe another one via an email, depending on your situation and whether or not you want to be notified in the middle of the night for different types of emergencies like blizzards, tornadoes, terrorist events, gas leaks, fires. You can choose what type of emergencies you want to be notified about and what method you want to be notified by.
Does that cost residents?
There's no cost to Code Red. We urge everybody to sign up. And if we had a real large-scale emergency, like, for example, the gas explosions in Lawrence, Andover, and North Andover, we can work with MEMA, and they have a system where they can send a message out to everyone's cell phone, whether they're signed up or not. And you get some weather alerts sometime in your cell phone. That's an example of the alert system that MEMA has.
And so that would be reserved for a larger scale emergency situation.
Right. We'd have to go through the MEMA EOC down in Framingham, and would be able to notify residents in the city of what they should do and what they should be prepared for.
Good to know that that's an option, though, that in those kind of situations we'd all get alerted on our cell phones, which are so close at hand.
Sure, and there are some people that don't have cell phones, so we use other methods like the TV station, the radio station. And in worst case scenario, we can work with the police and use bullhorns and drive down the street and notify people of emergencies.
Wow. So you will let people will know.
Communication is important, and people will know. And you can always call the police 911 center, police and fire 911 center, and we can give you any information that you might need.
That's great to know. What else didn't I mention that might be important for residents to know, or that you want to bring up on the show today?
Well, as I said earlier, it's great to have a plan, to practice that plan, and as time goes on, you can tweak it a little bit. It's good to have supplies available. Like I said, keep your batteries charged up, have an emergency generator available, and if you follow those basic steps, you can adapt it to any type of a plan. And when we do ask people to evacuate, we encourage people to evacuate. A lot of people like to stay in their homes when there's a flood coming or a big storm. They think it's not going to affect them. But if it gets to the point where we ask you to evacuate, it's important that you do before it's too late. I know we had a big hurricane down in New Orleans a number of years ago, and a lot of people were injured and killed because they didn't evacuate early enough. So it's important to listen to the officials when a big emergency happens in the city.
Well, don't worry, I will listen.
Great, thanks, Kate.
Well, that wraps up our segment this morning, and we're going to move on. And later in the segment, we're going to talk with Kerran Vigroux. So stay with us for our next segment, where we'll dive a little bit deeper into what residents can specifically do if there were an emergency situation. Welcome back to Healthy Living in Lowell. Now I'm joined by Kerran Vigroux, the Director of Health and Human Services for the City of Lowell. Kerran, thank you so much for being on the show.
Thanks for having me, Kate.
And tell me a little bit about your role as Director of Health and Human Services, and more so the Health Department.
Sure. So at the Health and Human Services Department, we actually have a couple departments that make up our group. The Health Department is one of them, but so is the Senior Center, the Library, the Recreation Department, and Veterans. Wow. So we're quite a varied group, but we're all involved in human services, so it makes sense that we work together.
And what about the Health Department? What's your role there?
So I'm the Director of the Health Department, and I oversee the different departments within that, which are school nursing, public health nursing. We also have our finance wing that oversees burial permits and body art and tattooing inspections in the city. We have our outreach and education, and we also have our substance use and prevention department.
Wow, that is a lot.
It's a busy place.
And also emergency preparedness.
Absolutely.
Which is why we have you on the show today.
Yes.
How do you interact with the other City of Lowell agencies when there's an emergency situation?
So as the chief mentioned in the previous segment, I am part of the department heads that come together in an emergency, but also in preparation for emergencies. So we're responsible to make sure even our department plans are in place, or that we're working on them, and that we coordinate well with the other departments should there be an emergency in the city that calls for that.
Wow. And so what are some of what we didn't talk about with Chief was, what are some of the health risks that might occur when there's an emergency situation?
Sure. So in an emergency, you can imagine that people are worried, anxious, they're not sure what's happening. And so anyone that has any kind of health condition that is made worse by anxiety or stress is affected more than they normally are. So we are concerned about people with anxiety, or people that are that they need electronic devices. So oxygen is something that we are concerned about in emergencies, that we lose power. Even things that affect the air quality, so then we see people that have asthma that are more affected. Certainly our homeless population, if it's an emergency that's affecting where they are, how do we take care of them, and how do we support everyone in our community is important.
There are so many things to think about. I'm glad that there is a plan, that it's, like the chief mentioned, looked at over and over again and practiced. Do you ever practice at the health department for an emergency?
Yes, so we're really fortunate in the city of Lowell. Our emergency response teams do a wonderful job, and the chief is, a fantastic emergency manager. And so yes, those plans are being worked on all the time. In the health department, we also exercise. So last year we did an exercise over at the Songus Arena to practice what we would do if we had to do a mass vaccination clinic. And that's when you pull out the plans and you check and see, will this work in a real life scenario? So that's really important that everyone does that.
Wow. So we have with us a big red bag with lots of things in front of it. So thank you for bringing this. Sure. And I think what we'd really like to dive into is what, as residents, and Chief mentioned it a little bit, but what as residents, what should we really have packed? What should we do when we get that alert that an emergency is here and coming, and try not to panic as I would do. So tell me, what are some of the first things that residents should do?
So first of all, the more we're prepared and the more planning we've done, the less we're going to panic, right? So in emergency preparedness, we talk about, number one, being informed, having the information you need. So the chief covered quite a few of those points that normally we would talk about. Making sure you know how your community notifies in the event of an emergency. So we talked about that, and the importance of people signing up for Code Red and looking at, Facebook and the city website for information. But beyond that, knowing what the evacuation routes are in your community. Where is your local shelter? Here in Lowell, we're really fortunate. We use our senior center, but other communities have different locations. So making sure you know where yours is and how you would get there in an emergency. Do you have a car? Does your neighbor? Is there a way for you to get there? So making sure you're informed. The place that most people would go is the www.ready.gov website, and that's FEMA's website. And on there is a wealth of information, toolkits, checklists, things that people need to get informed before the emergency.
Oh, that's good. That's what I need.
Right.
Yes.
You're probably at that level,
yes.
Right? But great that you already are thinking, I do want to prepare myself and my family. What do I need, right?
Absolutely.
So the next thing is to make a plan. And part of that is a communication plan. So making sure everyone in your family knows what to do in the emergency. So once you do have a kit, and we'll talk about that in a little bit, does everyone know where theirs is? Right. What's the plan if, mom and dad are at work and kids are at school? How are they going to meet up in an emergency? What's the plan? We all handle things better when we know, this is happening, and I know where I'm supposed to go and where I'm supposed to be and how to contact, my family. Another great thing is to have a person outside of your area, so maybe a family or a friend that doesn't live that close to you. So if the emergency is where you're at, you have a place that you know you can go meet up with people that is probably not in the emergency area. That's a great thing to have, so that's important.
How far should that be away? Should that be
Honestly,
5
you
to
don't
10
know
minutes
because
away, or-
right. You could have, the next town over. It could just be on the other side of the city.
Gotcha.
But something that if it's a neighborhood-related emergency, you know that you can go there. You know your family's going to meet up there, or that's a person you can all call in case maybe there's an issue locally that's making it so that your communication plan isn't working locally. You might have someone out of state that you can all reach. So different things like that. But again, I think at that ready.gov website, that'll walk people through some of those questions they want to ask and then decide as a family how they want to prepare for them.
Great.
Knowing if there are specialized needs in the family, so whether they're medical or medical equipment, you should know that ahead of time and be able to prepare for that. So the next thing we talk about is making sure you have a kit. Now, sometimes we have a kit that's about this size, and it's a backpack or a tote or a duffel bag, and it's ready to go. It's near your front door. I think of it as the place where everyone dumps their things when they walk in the house. So wherever that place is in your house is a good place to keep your quick grab bag. Okay? In that bag should be what an individual needs for the next 24 to 72 hours. So really basic, change of clothes, a flashlight. If it's for a child, throw in some extra little snacks, throw in some things that might keep them busy if you end up having to be at the shelter overnight. Because in a stressful situation, you want to be able to keep them busy. So it could be coloring books, it could be a deck of cards. Something that is maybe new to them, so it will also help, keep their attention. Maybe to make sure there's an extra charging cord in there, right? So they can play games or do whatever they need to do. Sometimes I would always make sure there's a first aid kit. They have smaller ones, but you want to have some basic bandages and maybe a little burn cream, some extra ibuprofen or something like that thrown in there, because you just never know. But again, on that ready.gov site, it'll give you an entire list of things that might be good to have in that kit. What I think is most important is that it's personalized. So, if it's a child, they have it. If it's an elderly person, that they have their, list of medications. You should always have in here your paperwork, copies of your paperwork. So you need birth certificates, marriage certificate, your lease or your mortgage, or just copies of all of those important documents that, should there be a fire in your home, should there be a flood, or something happens, you have copies. And now in this age of computers, right? Paper copies are good, but you could have those documents scanned and shared on a flash drive and in there. Put the flash drive in a baggie so that it's protected, and stick it in your bag so that if you end up somewhere and you have to pull up, all the doctor's information or what medications, individuals are on, your account passwords and numbers that you might have saved on your home computer, but you're not at home.
Right.
So those are great things to make sure they're in your grab bag.
I'm glad I don't have to take notes on this, because you've assured me that it's all on ready.gov, because my mind is spinning. Okay.
Right, it is.
All right.
But it seems overwhelming to have to plan for, and also like you think about the cost, of having to do this. Some of the things you're just going to grab from home and you're going to put them in, you're going to already have at home, and that's good.
Right.
Sometimes when you go out to the store, maybe you buy 1 or 2 additional things and you're working on preparing. Any progress is progress. So if, once a week you put in some Band-Aids or you put something, you're building your kit, and then it's not overwhelming either on your mind or in your pocketbook.
Right.
Right.
Okay.
And then there's Then there's the kind of preparedness that you do for your household if you have to stay in your home for an extended period of time. So that's, we know we're having a big snowstorm, right? We're in New England. We have snowstorms, we have snow days, everybody's in the house for a couple of days. Those are emergencies we know are always going to happen because this is where we live in this part of the country. We also know that sometimes we get a serious hurricane that can knock out power. Ice storms we've had that have knocked out power for weeks sometimes. So things people should have ready in their home for that are, as the chief suggested, non-perishable food. So you want canned goods. Make sure you have a can opener, a hand can opener, right? We're all used to our electric ones. Make sure you have that. You have snacks, granola bars, nuts, peanut butter and jelly, go far on crackers if you don't have bread. So making sure there's food in the house. If you have babies, an extra can of formula or diapers, hand sanitizer in case the water's out for whatever reason. You still want to be able to wash your hands. Make sure you have some hand sanitizer. The chief did mention water. It's about 1 gallon a day per person and per pet. So if you have a dog or cat, you want to make sure that, you know, they're taken care of. Ready.gov also has lists for how to prepare if you have pets.
Great.
Important to know. Some shelters also will take pets, so it's important to know ahead of time in that planning phase, would your shelter take a pet?
Oh my gosh.
So
it sounds like there's so much that we can do, and that residents really need to have this bag ready and have those kits ready so that they are prepared when this happens instead of scrambling around the house.
Right.
Thank you so much. I mean, I need to do this today, but I'm going to do it slowly.
It's good to
just
start slowly. Yeah.
And anything else we forgot to talk about?
I think also if people have questions, they can also call their local emergency management. So Chief Windward would more than be happy to talk to people. Us at the health department, absolutely. Give us a call. We can help you. We can help identify resources in the community, answer your questions. We're here to help. We're here to help you prepare, and we'll see you through the emergency as well.
Awesome. Thank you so much, Kerran, for joining me today.
Thanks for doing this.
And join us again next month as we dive into other health topics and learn more about healthy living in Lowell.